Hi, I'm Shannon McConville, and I study health policy at the Public Policy Institute of California. Today, I'm going to highlight some of the major changes in healthcare starting up in California as the result of federal health reform. Although the Affordable Care Act, or ACA, was passed in 2010, many of its most significant policy changes take effect in January 2014. California has chosen to fully implement the law, and given our state's size and diversity, progress here will be watched closely throughout the nation. First, I'll talk about California's new health insurance marketplace, called Covered California. This is the place where Californians who need to purchase health insurance can shop, compare, and enroll in comprehensive coverage beginning this October. Covered California has a selection of health plans with a standard benefit package. People with low and moderate incomes can get federal subsidies through Covered California to help pay for the monthly costs of coverage. There are three main criteria to qualify for subsidies. First, people must be citizens or legal residents. Second, they must have incomes between 100% and 400% of the federal poverty level. And finally, they must be unable to get affordable insurance coverage from their employer. But even with the available subsidies, people will have to pay for coverage, and those with higher income levels pay a larger share of the monthly premium compared to those with lower incomes. As an example, a 25-year-old single adult with no children and an annual income of $30,000 will pay between $150 and $350 per month, depending on the insurance plan selected and where he or she lives in California. Although it's difficult to know who will use Covered California, available estimates suggest that 2.6 million Californians will be eligible for subsidies, and between 840,000 and 1.2 million of them are expected to enroll in 2014. How will we know if Covered California is working? Enrollment will be watched closely, both in terms of how many people enroll and who those people are. To be successful, it will be imperative that young and healthy people value insurance and are willing to pay for it. Covered California is developing an extensive enrollment assistance program to help people get enrolled, and also investing in a broad media and outreach campaign. Another major provision of the ACA that starts January 2014 is the expansion of California's Medicaid program, Medi-Cal, which provides health insurance to low-income people. Before the ACA, people could not qualify for Medi-Cal unless they were low income and also had either a dependent child or a qualifying disability. But come January 1st, Medi-Cal eligibility will be determined only by a person's income, which must be below about $16,000 a year for a single person or $32,000 a year for a family of four. Available estimates suggest over 1.4 million Californians under the age of 65 will become newly eligible for Medi-Cal, and between 480,000 and 780,000 of them are expected to enroll in 2014. Getting people connected to insurance coverage is just the first step. Insurance needs to translate into meaningful access to health care. This will require that a sufficient number of healthcare providers participate in the Medi-Cal program and are part of the provider networks of health plans offered through Covered California. There are two other major elements of the ACA that take effect this January. First, there is a requirement that most people have health insurance or pay a tax penalty. And second, insurance companies must provide coverage options to everyone, regardless of age or health status. The penalty for not having health insurance in 2014 is only $95 per adult, but increases considerably in subsequent years. These tax penalties are considered essential in making sure enough healthy people buy insurance to keep costs down. It will likely take years to fully implement and evaluate the changes brought about by the ACA. In these first years, it will be important to monitor enrollment levels and track access to services so that we can understand how well the ACA coverage expansions are connecting people to insurance and healthcare. But this is only the beginning. Moving forward, we will need to evaluate the broader impacts on the organization and financing of healthcare systems and services, as well as progress toward the ultimate outcome, improving people's health. Thank you for listening.